get our Health and Human Services meeting for September 4th started. I will start with asking that we stand for the Pledge of Allegiance.
Pledge allegiance
to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Fred, for getting us started. I want to let committee members know that Sheila is on her way with agendas.
Okay.
We'll get started in the meantime. All legislators from our committee are here. Legislators Jonathan Anna, Stephanie DeVito.
Yeah.
Hans Petcher. And Mark Strong. So our first order of business is to approve minutes from our August 7th meeting.
I'll make a motion.
I'll second.
Any discussion about our minutes from the 7th? Okay, all in favor?
Aye.
Any opposed? Carried. We will go to department updates. We have no appointments at this time, and I'm going to stay in order. So I will have our department head, Cuddy, come on up from the Department of Health, give us a few updates, and she also has some resolutions for us.
Well, can people hear me in this microphone?
I think so.
Okay. I can speak louder. Would you like me to do the resolution or some updates first?
Yeah, let's take a look at your resolution. HH1 is authorizing the chair of the legislature and the public health director to enter into a contract with New York State for the bike pedestrian wheel sport safety program. I know this is an annual program. It's a contract that brings us about $20,000 or almost $21,000 to allow us to work with typically school districts, school-age children, et cetera.
It's been a great, we've been able to contract the Council on Physical Fitness, which is an organization operated by Joe Bushak, a retired phys ed teacher. We've been doing this for years. It helps us meet many of our injury prevention requirements. And really creative ways to work with primarily younger children, but certainly any age group. And it reinforces, yes, pedestrian safety, bicycle safety and rules of the road, helmet use. You'll see a lot of the bicycle gardens, and I'm not using perhaps the right term, at Play Space, for instance, there's one. They go to a lot of school districts, the walk to school day, the ride to bike to school day. That's all work that's done.
Rolled into this grant. Can I have a resolution for HH1?
I'll make
Or
a
motion.
motion.
I'll second it for discussion.
Okay. Any discussion on HH1?
I'd like to revisit the fifth whereas. It says that the funding of the WIC grant no longer covers salary and fringe of staff at 100%. The position at WIC will be reassessed. I'd like to amend that paragraph. If we could, and open it for discussion on the amendment. If we,
Jonathan, you're gonna have to speak up.
I'm sorry.
We're not.
I don't think
That's
we're on that.
not the.
That's not
I'm
the
on
resolution.
HH1. Where are we at? HH1. You're in August.
You're in August. We already went through that.
I'm sorry.
So we just have one resolution
That's
from
embarrassing.
Health and Human Services.
Oh,
and
I got
it's-
nothing then. I don't see what it
Okay.
said. I'm looking at it, that's the one I put back. Oh, yeah, I was wondering why that was cut under that. I'm like, what?
Sheila may be able to, when she settles in, help us out
No,
with
I downloaded
written
the wrong. I
or hard
downloaded the wrong
copy.
one.
Like an agenda.
Yes. I can't believe I downloaded the wrong one.
Anybody else need one?
I'd like one too. Thank you. Fred?
I'll use electronic. Thank you.
I know, I gave it.
So we will disregard Jonathan's
Yeah,
comments and
no,
move
no,
on.
no,
Any
I
other discussion about
downloaded the wrong
HH1? Hearing none, all in favor?
Aye.
Aye. Any opposed? Carries.
I had,
So Kathleen, would you like to give us your
I
report?
had
I
the,
would. It's a few updates that I think are worth all of you being aware. So the first is really just for your information. We've been doing quite a number of back to school vaccination clinics. I think the ideal, right, is for children to be able to get their required school vaccinations with their pediatrician or their primary care provider. But we've been finding over the last few years in particular, fewer and fewer physician offices are carrying vaccine for children, which is the vaccine supply, which is used for children who are eligible or have Medicaid or are uninsured. There's different reasons, and we're working, all the local health departments are really working with the state to say, what can we do to help improve the number of offices that carry vaccine for children? I think the other reason I think we're seeing more children than typical is because provider offices are so busy. So even families that are planning in advance are finding they can't always get an appointment within the time frame required for their children to start school. So in August and September to date, we've had 11 clinics just for school-age children and provided vaccines, numerous vaccines, and we'll get a report later about that, but for more than 75 different children. We've got 4 more clinics before the September, I believe it's the 17th date, where children will have to be excluded from school if they have not met their school age requirements. And then we have a few more vaccine clinics scheduled throughout the rest of September to help those children who may be excluded. And that is something that is performed. The school nurses do go through their vaccine status for all their students and inform parents of this. So that's one bit of information that's useful. I think the other, you might have all noticed, there's been some increased media attention about harmful algal blooms on Owasco Lake in particular. You know, it's close to swimming areas. It's frustrating for property owners. I'll say the good news is the drinking water treatment plants are doing a good job providing our water for those residents who get public water through Owasco Lake. And for people who are interested, if you go on the DEC website and you query HABs, you'll be able to get all sorts of information. You can get the information on our site also, but you can see where people report they have the blooms themselves. And there's maps that the DEC site maintains through the volunteer organizations that submit this information. And the other bit of information that I think it's of value for all of you to be aware of is Eastern equine encephalitis. You may have seen press release that we put out on August 15th. We put out the press release about a horse we were notified that was diagnosed on the 14th that died from Eastern equine encephalitis. That horse was in the Cato area. Then on the 29th of August, I believe, a second horse up north, I believe, Cayuga area, died from Eastern equine encephalitis. So while that's terrible, right, for the animals, for the owners, it really is the reminder to those of us who are concerned also about the human health that these mosquitoes are carrying triple E, and that is a very concerning disease. If someone does get it, it causes a lot of serious symptoms and can have some lasting effects. It can cause death. Some of you might have also read today, yesterday in Wayne County, West Nile virus was diagnosed in a human. So we monitor all of these things through the state because of the severity of the illnesses that can be caused by mosquito. We really try to encourage people to be careful to not have standing water, you know, like no bird baths. If you've got kiddie pools, things like that, turn them over and don't let the water set in them, because that's where mosquitoes breed in damp and wet areas. Which is why you often hear, like in Onondaga County, almost annually, they spray at Cicero swamps to try and kill the mosquitoes. There's areas of Montezuma that they spray fairly routinely to try and wash the mosquitoes. But because we had this second horse that died, I've written a letter to the state health commissioner requesting imminent threat for public health for the constituents of Cayuga County. And that's not a phrase to scare people. It's a phrase that's used. It's the type of declaration that has to be done, which will enable our health department for work that we do related to EEE, including the education and any partnerships and additional work we may do to get a higher rate of reimbursement of state aid. So each year, when we put together our state aid budget, we put an annual allotment into all the required categories, and there's many, many, many of them. One of them being vector-borne control of vector-borne diseases. So we have $2,200 in that line, right? And depending what's going on, it goes up or down. Well, you know, it's greater or lesser. Once we expend staff time that exceeds that $2,200, then we get 50% state aid and other work that's done specific to vector-borne disease control for this disease. We don't often do an imminent threat to public health. It was done during COVID. It was done when West Nile virus first came into our area, but it's worth doing. So the request has gone to the state health commissioner. State health commissioner will get back to our county. I imagine that it will be approved. Our contiguous counties, Wayne County, Onondaga County, Oswego County, they've all made that same request. They've already been approved because they made it sooner than us. One horse probably wasn't going to trigger that for us, but 2 horses in such a short time, it was just smart to get on top of that. So we're really going to be monitoring the situation and make some determinations. We're not looking at this point in time to do spraying. That's a much bigger decision that goes beyond the health department to have discussions about that. But we might want to look at more than educational information. Perhaps we want to get something like this available for people up north. But that's something we're going to be talking about a little bit more within the department, and we'll probably engage some more of our partners in the community should we move in that direction.
And the 2,200 you have in that line is what you'll use right now towards those efforts up north.
Correct. So it actually can go towards staff time. So our health educators that are putting together the press releases, they're putting together the social media, our environmental health people who are, and community health director who receive reports and talk with the state. You know, my time, Deanna's time, when we are working with our state officials and discussing this, we can categorize this area, and then those hours spent and be monetized. That's all I have.
Any questions for?
It is something we'll watch because Deanna had pulled some good information about statistics, and I think it'll be helpful. Just about mosquito-borne diseases in general. And so far there are 14 equine cases of Eastern equine encephalitis infection. So horses that have been diagnosed in New York State so far, 2 of which have been our county. That's a higher.
It's a high percentage.
So,
Thank you.
thank you.
Thank you.
Have you sent any traps up, and do you do mosquito testing, or you test them for EE or not?
We don't, and we made that decision a few years ago. When West Nile virus first came in, we're looking probably 20 years ago, when West Nile came out. It was not an option, and counties had to learn how to do mosquito traps and how to identify the mosquitoes. Then there used to be state people who could take some of these batches of mosquitoes and take a look at them for us. Those resources don't exist for us anymore, but we do know that our neighbor counties like Oswego, like Onondaga do some of this trapping. So we know if it's in their county, you know, the animals don't, the insects don't respect borders, so we don't.
Is that something you'd consider reaching out to if you identified a further trend, like in the northern half of the county, possibly looking for areas of potential triple E mosquitoes?
I think that's where we're gonna be able to talk with our partners in the community, like maybe our town and villages, who are gonna know some of the spots that are worse, right? So we know, for instance, if you want to do any spray, for instance, you have to work through the DEC and get special permits. And it's quite a process. But that's not to say it shouldn't be done, right? You want to prevent harm to humans. Montezuma has made, some of those decisions already, right? Cicero has done that. It can be done. It's involved. And while I'm not diminishing the death of 2 horses, I don't think that this merits spraying it. You have to take into account farmers and the crops, and you've got to be really careful about where things go. But we do have partners in those respective counties that we will reach out to if this is the direction we want to go. But if you're finding, Jonathan, a lot of this activity is certainly in your area, right?
Yeah, that's what I'm asking.
If there's questions, and Tom, actually in your area, right, also. We definitely are open to talking with town and village people about what additional work maybe they'd like to see happen. We kind of step our way up as far as activities. We're glad to do that.
Thank you, Catherine.
Thank you. And, thank you and Deanna for the email communications, because, we were just quickly alerted to these horse deaths and what was happening. And I appreciate knowing that quickly. Okay, social services, Christine Bianco. We've got 3, 4, 5.
I kept that while I got it.
We have 4 resolutions. So why don't we move through the resolutions, and then you can also update us. HH2 authorizes the Commissioner of Social Services to accept youth employment program, the YEP funding.
So this is new to us. We haven't received this funding before. County actually is eligible to receive this funding because we're designated as a GIVE recipient of this GIVE program, which is the New York State Gun Involved Violence Elimination Initiative. And because we are designated in that way, we qualify for this YEP, Youth Employment Program funding, which is intended to expand the already running summer youth employment program that we have, Kelly's here, that our employment training program runs.
And Kelly kind of gave us an alert, an update. She knew this was coming at the last report that she gave to us. So it's exciting to see $400,000 enter the county for youth employment programs. And there is a resolution that around working with, so this one is about accepting the fund. So
Yeah. So
it's not about contracting
Yeah.
yet. It's
This-
bringing in the funds.
This resolution is to accept the funds and also to enter into any subcontracts
Yeah, okay.
that we would need, and our
I thought I
intention
read
is to
that.
contract with Doug's department.
Okay. All right.
Move it, Mark.
Thank you.
Second.
Any discussion on HH2? Yes.
Do you anticipate the whole 400,000 training?
I don't think that we're keeping a portion. I think we're gonna have it run through to employment.
And it's X number of years?
So this is a 1-year allocation, and it's my understanding that they do anticipate this is gonna be refunded yearly.
Any other questions? Hearing none, all in favor?
Aye.
Aye. Any opposed? HH2 carries. HH3 is authorizing the chair of the legislature and the Commissioner of Social Services to contract with community action programs, Cayuga Seneca, CAT, for the rapid rehousing case management services. So this is case management, 100% funded to assist TANF families, temporary aid to needy families.
So this is a caseload of families that they have on the caseload. This is a renewal of a contract that we have with them. We've had this contract for a while. They've had, just to give you an idea of some of the data and statistics, in 2021-2022 year of this contract, they have referrals and are working with 54 families. 28 of them obtained permanent housing. And then out of those families, they also made 101 referrals to other additional community services to address, the needs of the families that were identified during their intervention with them. In 2023, they worked with 59 families and 20 of them obtained permanent housing. So a bit lower. And we'll talk about this in a little bit. This is some of the challenge with finding housing. So they worked with a little bit more, a number of families, but how ended up finding permanent housing for less than they did the year before. And then this year's round, 23-24, up until I think the end of July, they had received referrals for 39 families and were able to house 10 so far. Definitely, some of the feedback with the drop in numbers, that it's very, very challenging to find apartments, homes for families to rent that is within their level of income. But they're trying, and they are successful with some of them. I think it's still well worth it, to utilize the money in this way. Even if they only are able to house, the 10 families, that's still it's still pretty good.
Right, 100% funded, TANF family focused, and $83,000. I think it's money well spent, especially given the discussions we've had about homeless families, children who are homeless as a result of, family issues. So I'm wondering if, when you have time, those stats that you just provided for us, could you put those in an email or in writing?
Yep.
Just so I can keep a record?
Sure, I have them on a spreadsheet. I can
Of the kind of work that's happening and what we're spending. Any other questions? Discussion? Okay, hearing none. All in favor of HH3?
Okay.
Any opposed? HH3 carries. HH4 is amending the social services 2024 budget to accept 100% federal funding from the flexible fund for family services. If I can have a motion to put HH4 on the floor.
motion.
Thank you. So this is an interesting program. Let's tell us a little bit more about it.
So this is the triple FS, we call it, funding, and it does it's spread out among various programs that we have. It's federal money that we get that we utilize for TANF eligible applicants, so they have to be eligible for temporary assistance for needy families. We use money in the public assistance programs to help reduce the amount of time that somebody's on temporary assistance. We do employment related services with it, and then some supportive services. We have families that have some concrete needs that we think, maybe they need something for their home, or they need something to help them with, getting ready for work. We're able to provide them some assistance with some concrete needs. It's $275,000 that we're asking to take in.
Any questions, discussions following Christine's explanation? Do we typically would you expect this annually?
Yeah.
Or was that, okay. Well, hearing none, all in favor, HH4? Aye. Any opposed? Carried. And HH5, authorizing the Commissioner of Social Services to fill a transportation aid in the social services units. Motion to put this on the floor? Thank you. Thank you.
So we have budgeted one full-time and one part-time transportation aide. And our full-time transportation aide resigned recently, and we're looking to fill that. This person, this transportation aid helps immensely with the transports that need to happen for the foster children that we have to get them to their visits with their parents, to get them sometimes to appointments. The transportation aid helps sometimes transport parents that don't have transportation, be able to get into the visits to see their children. Sometimes we have to do things like take kids to doctor's appointments. And we also utilize this person to help with some supervised visitation. Someone needs to have their visit supervised. We have utilized transportation aid transports to just do the supervision of that visit as well. And it really is an immense relief to the caseworkers to have someone that can perform the task of the transporting. Without this person, just in the few weeks that we haven't had her, it's fallen on the caseworkers. And so that's taking time out of, away from the other work that they do, to do, basically. So this, is very, very helpful.
Any discussion, questions?
Here, it's here. It is a recent vacancy.
Yeah.
And, how many caseworkers are in jail?
Oh, I think that we are down right now 4 or 5.
Even though you've got permission to fill, you're still in the
Yep,
pipeline trying
yep.
to do that.
Yeah, we just received permission for a few of them last month, trying to get them filled, get the list and start doing interviews, but we're down almost a handful. And that's a lot.
Part-time transportation aid, is that a filled position or?
The part-time transportation aid is filled and we're utilizing her as much as we possibly can. It's very, very much needed.
Any other questions, discussion? Hearing none. All in favor of HH5? Aye. Any opposed? HH5 carries. Thank you. Christine, any other reports for us?
I didn't prepare a report. I think that just just to touch on a couple of things. Our homeless numbers are still kind of remaining steady. We have, as of Friday of last week, we are providing housing to 107 single individuals and 36 families. So our numbers have really stayed pretty stable.
Based on that.
Which is concerning, through the summer. I do anticipate probably in the next few months when the weather gets cooler, colder, and we're under cold weather, that number will tick up a little bit. And also some people that are choosing to, stay outside will not feel as comfortable doing that and will be seeking shelter from DSS. So, definitely concerning when the numbers are staying up. Continuing to utilize the beds that we have available at Chapel House, through the Prevent Shelter, and also the transitional apartments that we have with Rescue Mission, and also with transitional apartments through Cayuga Health Network. The rest of the folks are in. So it's a high number.
Legislator Strong has a.
If you could, just, do you have an idea number that's actually held?
So I can tell you that we had, of the 36 families, we had 13 of them placed in the transitional housing slots. So that would be the 36 minus 13, the rest would be in hotels. 26, so 36 minus 13, right? So we have, what is it, 23?
Yep.
So 23 of them are in hotels of those families, and then of the singles, looks like we have 25 placed through Chapel House and the Ray of Light programs. So 107 minus 25. So 82.
Just a reminder, we have a set rate that we pay the hotels, or is each hotel different?
Each hotel is different. Each hotel pretty much tells us what they're gonna charge us, and, the rates vary. Some of them, I think the lowest rate that we have right now is 86 or $87 per night. It goes up to over 107, I think, one of them charges.
Thank you very much.
And last year, in the 2000, as I remember, 2023 fiscal year, we totaled at the end about 3 million in housing costs. Is that
Yep. That's where I am.
The other thing I just wanted to mention was a quick thing, I won't go into this too much because I know you're all aware. I just wanted to say thank you to any of you that are here that have made taken the time to come up and visit our folks that are out in the post office space. The employees have feedback of, seeing legislators come up and actually look at the space that they are working in has been positive. They are they're working very cramped quarters. It is not by any means an ideal situation to have that many people packed into a small space like that. And I know we're working on solutions, but I think I just wanted to mention that they appreciate that you have been, interested in seeing what the environment is like there, to see how many people are in there and what it's like to be there every day. Definitely isn't a space that was set up for over 30 people. And, to say that they're stressed, it would be an understatement. It is very challenging for them every single day. And, they're, maybe some of them are even here, not tonight, but they've been coming because they're interested in learning what the county's plan is. And, I think that, having folks show up at the space, helps them know that, people are paying attention. So I thank you for that, for all of you that have done that, and anyone that hasn't that wants to, we welcome that as well.
Thank you. And I look forward to the rapid rehousing.
Yep, I'll send it to you.
Thank you. Okay, Lauren, I skipped you, so you can come on up. Thank you for the blip. We do have 4 mental health resolutions. So why don't we start with HH6 before your report. HH6 is amending the mental health 2024 budget to adjust state aid funding for contract agencies.
So this is based on the COLA that we receive each year, so this is just an increase in our results today that we receive, and it's just adjusted into the budget line just to go up that, it's not.
Motion to put this on floor.
With Mark.
A second.
So typically, the Community Services Board and a subcommittee works toward, the kinds of funding that we see on the resolution.
Yeah, so
Those
this
amounts,
is
it's
all,
just not random.
these are all existing contracts that we already have with all the agencies, that's just sending those up each year.
Any questions or discussion for Lauren? Hearing none. All in favor of HH6? Aye. Any opposed? Hearing none, carried. HH7, authorizing the legislature to create a budgeted staff social worker. Again, this is the HELP program position at the Community Mental Health Center. So for months, for years now, actually, we've been taking advantage of the HELP program. So this is another, what looks like a create, but really is because we have to run this through the Social Service Commission to get the title changed, the job title changed.
Yeah, so this is due to a vacancy, somebody, one of our staff social workers resigned, so now we're putting it through as a health position. That was approved by civil service, so they don't have to take a civil service exam when they're hired.
Did I get this one on the table?
No.
Fred?
No, not
Okay. Thank you.
I'll second for.
Any questions, discussions for Lauren? With Legislator Strong?
Does this change in title, change benefits, wage down the road? In any way, shape or form?
No, nothing changes other than that they don't have to take the civil service exam. That's the only thing that changes.
Thank you.
Heidi,
Yes.
I'm reading down at the bottom. We're just defunding the position or are we abolishing the old position? Because I guess that's my question.
So eventually, Jonathan, they will have to be eventually placed back in the other
That's
title.
why we're only
Right.
defunding it because we're just doing this now under civil service. Eventually go back to the other
Because-
top title.
Correct.
Exactly.
Yeah, that's what.
Because
that's what I was
eventually
asking.
help will,
Yep.
that program, the state will say, we're done.
I'm with
And
you.
all of these will have to be,
Thank you, Lauren.
any other questions, discussion?
How many vacancies do you have?
I believe it's like 5 or 6 social positions that were down. 2 of them are grant funded. Those are based on the SAMHSA grant that we received. There's positions in there.
You haven't been able to fill those.
So we've filled one. That person has resigned, so we will have a resolution next month to fill it again for that position. But we do have somebody starting on the 16th. And we do have 2 people that are potentially hired. They just need, one is waiting for a limited permit and one is waiting to take the licensing exam very shortly. So the 2 of them would then come in as, so we have a total of 3 that we would hire.
Of the vacancies, how many are seeing cases? I mean,
All of them are seeing cases.
the ones in the grants also will end up with caseload as well.
So the way that the grant funded ones are, we have those so that our clinicians that are existing at the clinic can go out to the school districts and they can offset the caseloads that way and see their clients at the clinic. Because they're gonna have to transfer their caseloads and see kids at school. That's kind of how we work that out. Yeah. But I do think if we hire these, get 3 clinicians in the next, month or so, I think we'll be in a good position for those clinicians to go to
Except for
school.
the exam has helped.
I don't know if that's made, I can't say. I don't know that it's made a huge difference, to be honest with you. But it's one less thing they have to do, just,
Right.
I think it will be probably be helpful to the individuals themselves, yes.
Legislature Strong?
Just to follow up on the main question. So if they don't have to take the exam, are we getting a lesser quality individual that's applying for the job or?
I would say no, because they're still required to take the licensing exam for the state. So they have to be a licensed social worker or mental health counselor in order to be hired anyways.
The civil service test they're exempt from.
Correct. So they still have to do all the licensing requirements through the state.
I know we've heard from, in the past when this has been asked, we've heard from Christine Bianco that help has indeed helped her department with caseworkers. That her feeling, I mean, I don't want to speak for you, but in that particular situation, you have been able to find people more quickly without the exam.
As for us, for DSS, it was about, the tests that people take for civil service are only given at certain points, for many of these positions that qualify for help. We use it for, human services examiner. And sometimes they go over a year before being offering a civil service exam, and so we weren't catching people when they were sort of interested in the job. They would hear from us like a year and a half later, and by then they had already moved on and found work. So we found it to be, they're interested, there's an opening, they fill out an application, we interview them. They still have the same qualifications of, their, whatever their education requirements are, or work experience requirements. So in that way, they're the same folks applying. They just haven't had to take the civil service exam.
And I would say that slides over to your point that you still have to hire people who have the correct licensure and qualifications and experience and educational background in order to be a clinician. So that quality is there. Any other discussion, questions? Hearing none, all in favor of HH7?
Aye.
Aye. Any opposed? Hearing none, carried. HH8, authorizing the chair of the county legislature and the director of community services to accept a grant from the New York State Department of Health to address drug overdoses. Thank you.
Second.
Thank you. HHS, this is a just under $100,000 grant. 99,920.
It's a total of $500,000 grant for 2.5 years.
Oh,
And it's related to, harm reduction. So it's about creating a health hub, at the mental health clinic. There are some positions involved in this. I know we talked last month about that, or that there would be a resolution coming for a second grant that Monica applied for. This is that second grant, but they will all be contracted positions. They will not be county positions. And actually, to my surprise, we have had quite a few applicants for the grant assistant from the previous resolutions.
right.
We actually have applicants that we probably can hire for this grant as well for that position. So we feel good about keeping them as contracted positions and not county positions.
Lauren, these grants, specifically this one, the $500,000, do they help offset existing programs or are these explicitly for new programming?
Programs.
And I did notice a lot of emails and calls through various forums around looking for the contracted position that we had asked in the, in August. So I'm glad to hear, I was sort of hesitant about that particular, grant position, whether we would find somebody qualified who would do it as a contractor. So that's really wonderful news to hear that.
Yeah, I was definitely surprised. We actually had a lot of applicants, to be honest with you. So we're hopeful for the other positions in this grant, which one will be a peer position and one will be the grant coordinator position on top of the grant assistant. So we're hopeful that we'll have the same response for those.
And Monica, will she be overseeing? Is this money in these grant work that you'll have her oversee? Okay, any other questions, discussion? HH8, hearing none, all in favor of HH8?
Aye.
Aye. Any opposed? Carried. HH9 authorizes the filling of a full-time staff psychiatrist position at the Community Mental Health Center. I did not find this a surprise because you have been telling us for at least several months now that you knew you were losing psychiatrist.
Yes, so our one and only staff psychiatrist, full-time position at the clinic, is retiring at the end of October. So this would allow us to fill his position.
Anybody second?
I'll second.
Discussion, questions of the fill of the psychiatrist? Hearing none, all in favor? Aye. Any opposed? Aye. It carries.
Are you opposed?
Yes.
Yes.
Thank you.
Anything to report out?
Not too many updates. I just wanted to share. I know I mentioned just a minute ago about the grant funded positions for the staff social workers. We are, moving forward with that grant. We have our EBT in schools training set for the school districts at the beginning of October. And then our clinicians will then start implementing that in the schools. So for anybody that doesn't know, that's the universal approach will be taught by teachers, school teachers to, I think most of the school districts have opted to do middle school first. But it's really going to be a kind of a growing thing over the course of the next couple of years with the grant. And then there's gonna be like a tier 2 and tier 3 approach for our clinicians that are gonna be at those school districts. So we are moving forward with that. We're really excited to get into the schools and start providing that. I think it's gonna be, it's prevention, but also, meeting the needs of the schools where they are and cutting down on any barriers for the kids getting to our clinic or other clinics to be able to get the services they need right there and provide comprehensive DBT right there, which is huge. So I just wanted to share that's moving forward. We're really excited about that. And really, that's all the updates I had. I know, this will be my last meeting, before I go on maternity leave. So Maureen Brennan is the deputy director at mental health. So she's going for me. So you want to really I'll be around.
Thank you. Office for Aging, Brenda Wyman, our Office of Aging Director, Department Head, has one resolution, HH 10, which is also authorizing the chair of the legislature, director of the Office of Aging, to sign a contract with Boyle and Anderson PC for legal counseling services for seniors.
Forward.
Second.
Would you like to review?
So this contract is to do what we do a lot in that we get multiple funding streams to provide services to older adults in the county. Some of the funding streams are very set on what we can do with them. Once in a while, we have some freedom to determine where the need is greater and allocate some funding to a specific service that we couldn't meet under the initial funding stream. So that's what we're doing here for the first time ever. And I can recall, we have more people calling for power of attorney, healthcare proxy, and will preparation, questions about property, some different things that I think just reflects the fact that the population's older and that aging and that people are trying to put in place the things that they need to do, plan ahead and be prepared. And so we have maxed out the contract for the year with Boyle and Anderson. However, we have additional funding and another funding stream that we can use for the same purpose. So our goal is just to extend the service through March that we would otherwise have to cut off right now.
Any questions? Legislators, Joe.
Just to be sure that I heard you correctly. This program is completely funded and there's some extra, another grant or something that you use to last through till, did you say? March.
That we have state funding is 100% funded.
Thank you very much.
I didn't catch much of that because of the fan. So I guess this is not costing the county anything, correct?
We just
That's-
have to have
that's short of
a
it.
contract in place to show why we're using this funding stream for this purpose.
Okay, thank
To
you.
satisfy our state officer.
I just didn't catch it all, so I apologize. That's all. No, it's not you, Mark. I can't hear and I don't speak loud enough either, so it's okay. And I don't know what that is either. We learned that earlier in the meeting, so.
Any other questions, discussion? Hearing none, all in favor of HH 10?
Aye.
Any opposed? Carried. Other updates?
I just wanted to summarize in my report that we are always doing community outreach when the weather's a little better and we can travel. So we've been to Sterling, we go to Radia tomorrow, we've been to Booker T, and then we're doing our big senior fair on September 25th. We were out at the mall. There's a group of us that work together, a couple volunteers and our staff. We were out at the mall today because every year we're very fortunate the mall lets us have the event out there, but who's in the mall, where they're located changes. And the mall's actually fairly full right now. So we were looking at where we're going to be located, what rooms we're going to use for consultations, what rooms we're going to use for presentations, getting all that layout. So there's quite a bit of event planning that goes into that, and signage, advertising, and all that. But we're looking forward to that. We have 70 vendors that are signed up, and we're still getting requests. If you don't know yet, aging is big business. So we get all kinds of people looking to be a vendor at this event because it's a big thing now. And people from outside our county are requesting to come in and talk about what they can do for older adults. I want to thank Steve again. We're very relieved to be able to get into the county office building basement to get all our supplies and equipment for the big event in September. It would have been very costly to have to try to recreate a lot of the things that we already had available to use. So got all those things out. What about that? I want to thank our volunteers, web centers, Heidi and Betty Monte, who have been working on, they're volunteering with the senior fair. They've been working on a project where we're putting together advanced planning, healthcare proxy, advanced wishes information. We've been working on that. It's a huge project. So we rely on volunteers, not only for our nutrition program to deliver meals every day, but various other projects and things that we do throughout the year. And then I wanted to mention also that we will shortly be sending out the annual letters that we send out to every town and village where we deliver meals, asking for money donations to our nutrition program. That typically brings in about $8,000 to $10,000. And of course, every bit helps because our budget for our nutrition program is one of our biggest expenses for the aging and one of our most important programs. So that is something that the legislature has asked us to do from year to year. Ask the towns and villages to contribute. So those letters will come shortly.
Thank you. All right, we will move on to our final department head, Deborah Dennis, with the Youth Bureau. We'll start with your resolutions. You have two of them.
Yep.
That are resolutions to authorize the entrance into contracts with agreements with other agencies. So HH 11, authorizing the chair of Cayuga County Legislature and the director of the Youth Bureau to enter into a contract agreement with Booker T. Washington Community Center using ARPA funds.
Correct. Just to elaborate a little bit more on this program, Booker T. Washington was fortunate to receive a large grant from New York State, $7 million more than they typically have. However, that is only for elementary age children up to grade 6. So unfortunately, that cut all of their funding for junior high and high school, where they typically have 200 to 300 students participating. So they've really been trying to find alternate funding to get this program started any way they could. Right now, they're proposing 2 days a week. It would still provide meals and transportation home by the school district. So we're requesting to use the remainder of our ARPA funds, $25,000, to help that program get back started here in the community because there is a need for that.
Can I ask someone to move HH 11 for discussion? Thank you. Any questions, discussion? This is the last of the 30,000 of the 250,000?
Yes, that's correct.
Thank you. Was that your question?
Yes.
Okay.
That was my question.
And your question as well? So does this include early on? I want to make sure something didn't get missed. Early on, we contracted one of our first bits of money that we gave from ARPA through the Youth Bureau was for an evening teen center that actually dissolved.
Correct.
And we had thought ahead and made sure that that particular program was paid in like annual installments. So obviously there's at least one annual installment that could come back to the agency. Does the end of ARPA money include?
Yeah, because they had
That program?
given me plenty of notice and time that program wasn't going to be continued.
Okay.
So the remaining funding that we kind of had penciled or set aside in case the program was to continue,
Okay.
got put back into.
Got folded into what the advisory
Advisory
committee has been
board, yeah.
looking at. Okay. Any other questions, discussion? Hearing none, all in favor?
Aye.
Aye. Any opposed? Carries. And another authorization for the Youth Bureau to execute agreements with various agencies to provide youth development services.
Right, these, two agencies, I'm sorry.
I just wanted to get a motion to put it on the table.
I'll move it.
Second, Mark.
Thank you. If you'd like to describe the resolution and the agencies that you're contracting with.
These two particular agencies, we have already, have a resolution for. This is just extra funding that was not, that was just extra funding that was not claimed to put back into these programs that they had asked for. We weren't able to initially grant them their entire request. One is for the Auburn YMCA summer swim lessons, where they did 6 weeks of swim lessons for 52 children. We had already authorized giving them $1,690. This is just giving them extra money to reimburse them for that program because they did request up to $6,000 for that program that we weren't able to give them. So this is just adding the 1327 onto that contract. And the other one is with Northern Cayuga Little League for an additional $339 on top of what they've already done to close out on 2024.
Okay, thank you. Any questions, discussion on HH 12? Okay. Hearing none, all in favor? Aye. Any opposed? Carried. Right, thank you. Do you have updates for us beyond those resolutions?
Just a couple, I just wanted to let everybody know applications are still out. We're accepting for 2025. So I've gotten a couple in, still slow going, but I plan on next week following up with everybody. Just as a reminder that I'd like the applications in by October 1st, so I can meet with our advisory board to go through all of those applications. And one important thing coming up for the Youth Bureau is I'm planning the logistics currently for Student Government Day, which is going to be at our October 22nd legislative meeting. This year with Cayuga County, as we all know, everything is different than it has been in the past, spacing and whatnot. I do have many departments who unfortunately aren't able to participate this year just because they don't have the space. So right now I'm looking at 12 different departments who are able to participate. So that's great. That's a little less than we had last year, but I think that we could make it work. Might not be able to have as many students because I know that the legislative meeting we have that day, based on the number of departments that can participate, our legislative meeting that day with more students than we typically had in the past. So I will keep everybody aware of what's going on with that event. I'm getting ready to see that it needs to run out, and I'll be ready to reach out to the schools now that they're back in session. I just have to work out a few more logistics with a chairperson as far as location and everything. I know that Sheila and Amanda have been working on the details and getting quotes for the luncheon that goes along with that, as well as they've been working on a guest speaker.
And do you anticipate that we would have our actual legislature meeting at the venue?
That's what
So we're not moving back and forth?
Be there.
Okay,
It is, okay, yep, so it will be, the venue again for the luncheon will be over at Emerson Park, and that's where the legislative meeting will take place as well. So I'm going to work with the schools. I'm hoping that they're gonna be flexible with their busing, so a lot of the downtown locations, perhaps the school buses can do a drop off downtown, maybe a couple of stops, because they have an hour and a half anyway, so I might adjust the time some more just to provide transportation for the students to the different locations.
thank you. Thank you for all that planning. We look forward to it.
Thank you.
All right. I would entertain a motion to adjourn.
Move it, Mark.
Second.
All in favor? Aye. Thank you.
5 minutes.
Committee chairs, man, and.
I'm trying to follow.
It's just down.
Oh. Are there extra agendas, Jeff?
Oh, it's meeting order.
Amy and I were supposed, oh, sorry, never mind. And she said to invite the committee chairs.
Legislator Elaine Daly, Stephanie DeVito, Robert Shea.
Yep.
Tom Winslow.
Yep.
All right. Can I get a motion to approve the August 7th, 2024 minutes?
Move it.
Second.
All in favor?
Aye.
Let's start with department updates and we're gonna start with 911. Denise isn't here. I believe Ben is here.
Over here.
Come on up. You can sit at the table, you can go to the mic, whatever you want to do, my sir.
Set the principal's chair.
Yeah.
We throw things if you sit there.
I do not have any updates. This was kind of a last second thing, me attending. But I can tell you, we did interview today for, we have 2 openings and we did interview a candidate today. So we are progressing in regards to that. Other than that, I really don't have anything.
You interview one candidate, is that,
Yeah, we previously interviewed 2, we interviewed 1 more today. We have 2 openings, so.
that's off the current list, correct?
That's off the current list, yes.
Thank you. How's everything working over there now? Verizon got everything fixed for you?
Yep, obviously, as Denise said, that was an issue with the pole being struck that night. It housed a really important part of our club network. Locked us out of the system, that's repaired it, so everything is working fine right now.
And the Seneca County plan is supposed to work?
It did, we had, I gotta give a lot of credit to our dispatchers. A couple of them really stepped up and said, we're willing to go over there. They went over there. They sat them down, they had a laptop to work off of, and they were able to answer calls that rolled over there and give them back to our dispatch.
Dispatch in your office wasn't affected by the outage, just the calls coming.
Just the phone, just our CAD system, our radio system, everything else worked as it's supposed to. And once we got everything situated, they really worked really well together.
Very good.
Worked as good as it could have, I think.
I think, that's what I think, so very good. Not good circumstances, but your training kicked in and we're back up.
Yep.
Any questions?
Thank them for us. That was
Absolutely.
an unusual situation there.
It was, never happened in my career, and I've been here 20 years, so
Hopefully it's the first and last.
exactly.
So, anybody else? Ben, I appreciate you coming in today.
Absolutely.
Appreciate it. Thank you.
Sure, thanks, Ben.
Mr. Hoskins, are you in the house? Oh, John, I'm sorry. Didn't see you back there. I'm sorry.
I think Lloyd was here the last couple of months.
Good evening. Everybody away.
Good evening. So you all have my report, nothing radical in there. Obviously, I will entertain any questions that anyone has. Outside of that report, I think the only thing worth noting is that this may have been discussed last month. I wasn't here with the new family court judge position coming in. We are going to have to relocate. We're currently in the courthouse. That space will no longer be available to us.
Did they give you a date on when they're kicking?
They have not given us a deadline yet, obviously, before January 1st, but I would assume well before January 1st, they haven't given us an actual.
Guessing right after the election, probably
Thereabouts, yeah.
we haven't, there's been no discussion on where you're going.
We've had conversations with, we've talked to Steve, to Shereen. It's being worked out, but we haven't settled on anything yet.
Any questions? All right, well, thank you.
Thank you.
All right, I know Dr. Duncan's not here. District Attorney Antonacci. Hey, Brittany.
Chair. Good evening, everyone. We are very busy. August is notoriously our busiest month. So we had 24 grand jury presentations. We usually average around 15, 16 a month. So it's been a busy month for us. But everything's moving well, moving smoothly. We have a good team. And I don't have any other updates and I don't have any resolutions. So.
Anybody have any questions for the district attorney? Yes, sir.
You're fully staffed right now.
We are fully staffed. Yes. It's been wonderful. I'm very, very grateful for that.
Anything else? All right. That's painful.
Thank you all so much.
Thank
Have a
you.
good night.
Riley.
Riley's gonna spoil the whole thing.
Keep it on roll, Riley.
Very brief this evening as well. Since The update that I put out last week, we had an additional 5 calls, including a structure fire, but one of those was a 3 to just shy of 3.5 hour rope rescue at Carpenter's Falls. We had a woman fall down a roughly 20-foot bottom of a 450-foot embankment. And we had almost 40 volunteers between 3 town district, which is West Niles, New Hope, Sempronius, Moravia Fire Department, as well as our county rope rescue team there. And over the span of just shy of 2 hours, we were able to get her extricated out into a waiting ambulance. So I really want to just extend a bit of thanks to that entire crew. We had almost 40 volunteers on that scene working together to get this woman up and out of a very known but very technical area here a couple times a year. And within that, it's just something where we're tying out the end of our season. And that was kind of our highlight. The other is the health department all took off. But one thing I did want to point out within the report was last year we adopted a trailer the health department had previously received out of federal funds, using some grant funds and a little bit of creative editing within our own budget. We spent less than $5,000 to turn it into an extended deployment trailer, which is something that now has heat, AC, portable cots, water, and yes, even a camp toilet to send our teams out of county and within the county to extended incidents. So if we have something like Steuben County flooding and we're asked to go through the statewide mobilization plan, we can do that. But if we needed to pop up an area, we have that ability as well.
Do you know if the health department had to get permission to change that, or after a certain period of time?
After 10 years,
then it's whatever happens,
and
happens.
conditions of the grant,
Okay.
which is why they turned it over to us.
Yep.
Last quarter of 2023. And over this year, we've gotten it re-lettered and outfitted.
So it's 10 years is that
It's
magic?
10 years was the magic number, and
Okay.
they
Great.
just did a transfer of assets to us.
Yep.
We're very appreciative of that. Other than that, does anybody have any questions for me?
Mark,
Noticed in the report, Riley said the trailer or vehicle is station and
It should be delivered this month. We're expecting final photographs of the new rehab unit through quality control at Matthews Specialty Vehicles sometime this week, if not early next week. And intended delivery is set for the 15th. And then we'll have graphics and radio outfitting completed hopefully by the end of the month. But our hope is to have it in service the first week of October. That's a long time coming, but we're excited for that as well. Yep. Anything further?
I'm all set, Ryan. Thank you so much.
Thank you, Riley.
Tyrone.
A little uncomfortable here.
Yeah, this kind of looks like you're in school.
Well, it's been a busy month. Business has been good. I've given you some updated probation numbers. I don't know if anyone has any questions on our current numbers.
Not memorizing last month's. Is this similar to, is this higher or the 680 active cases?
It's probably right around the same.
The same.
Roughly. Investigations, probably down a little bit. We've been able to waive some, so that's been kind of helpful. But still, we're doing quite a bit.
How do you waive an investigation?
Judge, DA,
Oh, okay, gotcha.
defense counsel.
Tyrone, what's your ratio right now? How many cases is each of your probation officers carrying?
Roughly anywhere between 70-ish and 80.
That's still high compared to standard practice.
Oh, they're way high, but
What's standard practice again? You're in the 30s to 40 range, is
yeah,
that?
about 40.
Up 40?
Is that a month? Is that a month?
On case.
Or a year or
For
a week?
The
The amount of cases that an individual.
It should be, that's what they should have, like as general practice, because it doesn't vary. Most of these people are either on 3, 5, 10, 6 years. So it could vary on expiration of the case.
Okay, thank you.
I know we had this discussion early on in the year. We had an appeal for you. I was just curious if that, I know it made it down at the time, but it seems like your numbers at 680 number seems a little higher to me. I don't know if that was, I think it was
No.
something earlier in the year.
Like, because you would say some of these cases are like, you might have some that are, it might be the same person with 5 cases.
Multiple charges, and I see what you're saying.
So it could be, that could be where the,
So it's not technically 680 individuals, it's 680 cases. Is that
right.
say? Okay. Anybody else?
I should take that back. It's individuals.
Individuals.
It's individuals, but cases could be, one person could have 5 cases or 4 cases. And then, sorry, I don't have any resolutions.
No one does.
Don't be sorry.
No.
Sorry about that.
Sorry.
Sorry there. Talking about spending money.
You have to try harder next month.
Yeah.
Yeah.
Thank you.
Anything else? All right, thank you, Tyler. Appreciate it.
Thank
Sheriff. Sheriff has no resolutions either. We'll just start that off.
Moving the record tonight, and I'm gonna ruin it. Okay, if I stand up here.
Yep.
I invited Heather Petrus along with me tonight. She's the executive director of the council meeting. Not Heather, but I think most of you are familiar. We wanted to give a presentation, move through this as quick as we can, be respectful of your time, but a presentation about the status of our jail reentry program. We're coming to the end of a 3-year grant cycle, grant that we've obtained from the Bureau of Justice Assistance, and we've applied for an additional 3-year grant to continue with that program. We're waiting to hear if we got that. But I did want to just give you some of the stats that we've been able to obtain and let you know where we're at with that to date. So I think it's good news. That's why I wanted to share it with you tonight, let you know where we're at. And with that, I'll let Heather kick this off.
Hi, everyone. I am Quiet Petrus, so this is tough for me. So just bear with me.
About that.
And I'm not here to ask for money, so that's another good thing. But I did accept the invitation from the sheriff to come here to talk about our reentry program. Because I think that collaboratively, we've done an outstanding job, and I think it's important for you all to hear about the wonderful work that's happening because of your sheriff. So we will give you a quick overview. So as many of you know, we have had a long history of collaboration and partnership between our agency and many of the community agencies and the sheriff's office. So Cayuga Counseling has been providing alternatives to incarceration and detention that are contract services with the probation department in both Cayuga and Onondaga counties for over 30 years. So in addition to all the behavioral health services that Cayuga Counseling does, we have a whole other umbrella of services that we are the leader of the contract agency for. In addition to that, we also, as an agency, applied to New York State DCJS to get funding to be able to go into the jail and provide cognitive behavioral interventions, so evidence-based interventions. We have had that grant now for about 7 years, and we produce wonderful outcomes. So a few years ago, the sheriff approached me, and I think it's important that you hear this from him. This is extremely unusual that it happens in this manner, so I think it's important for him to tell how this reentry program came about.
So prior to taking over as sheriff, I worked for a number of years as an investigator with the sheriff's office. My desk used to sit right next to the window by our lobby where incarcerated individuals would be released. I'd watch them walk down the sidewalk, walk down the road. And it always bothered me that we had this population for such a long time at times, and we weren't doing really hardly anything to try to help them be successful, to transition successfully back into our community. So for many years, I watched that happen. One of the goals when I took over as sheriff was to change the way that we address how we treat the incarcerated, how we prepare them for reentry, how we work to reduce recidivism. That was important for me to look at that and try to change that dynamic when I took over. So in 2019, we added a transition coordinator, one transition coordinator that falls under the umbrella of our sheriff's office. She started to do a little bit of reentry work to try to help prepare people for reentry, but it was just very clear to me that it was very overwhelming, the amount of challenges that we were dealing with, the amount of people in our jail that were dealing with trauma, that we're dealing with addiction issues, that we're dealing with mental health issues. I realized that we needed to really do more than we were doing. So I stumbled across a grant opportunity through the Bureau of Justice Assistance one day, a 3-year grant that awarded us, did ultimately award us $750,000. When I saw this grant opportunity, I reached out to Heather because I knew that Heather had the ability to not only apply for the grant, but that her agency could help us administer the grant if we were to get it. We were awarded that grant, and that's where we're at today. So from there, we want to talk just a little bit about what we've done with that grant, where we are.
So when the sheriff reached out, I was very transparent that I knew nothing about reentry. I'm like, I think it's amazing. I know nothing. The one thing that I did know from other contracts that we have on a federal level is that they're extremely competitive to get. So it happened to be around COVID time. So we set up internal committees between both of our agencies. Brian's, of course, led by him, and my internal committee led by me. But I had the opportunity to go into the jail and meet with his staff because I had never been in a jail. I had not worked in a jail. I didn't know the lay of the land of the jail. I knew it was completely different discipline than I was used to. And I knew it was important to figure out. We knew that the only way this was going to work is if there were buy-in from both disciplines. And we knew that we had to have that cross-disciplinary buy-in when we were developing the program. And we wanted both of our staffs to be very much a part of that. And it needed to be reflected in the RFP that I was writing. So it was a very interesting process, but we kind of looked at recidivism. Whose problem is it? And, you know, the best answer to that question is it's the community's problem. It's everybody's problem. It's not the jails. It's not the mental health. It's, you know, everybody. So early on, we knew that we wanted to include all of our community-based partners. We're very fortunate here in Cayuga County to have such strong collaborative relationships among all of our various entities and human services. We knew that we would need everybody in there. So we started looking at the attributed factors. What increases the likelihood of recidivism? And it's well documented, well researched that individuals, peers, and their associations really attributes that level of education, social stigma, inadequate skills, social skills, relationship skills, coping skills, lack of skills, addiction, behavioral health conditions, homelessness, and unemployment. So we knew that that was kind of what we were going to focus on and how we were going to build this program. So this is just an example of all of the incarcerated, of many of the incarcerated individuals that we have here in our community. So I'm going to use Bob as an example. It's easy for us to illustrate the work.
So you looked at his resume, didn't you?
Yeah. So Bob comes in to the jail and he's assessed, and we find out that he has been diagnosed with bipolar disorder. He has substance use. He has high blood pressure, so physical health condition. He's homeless, he has no vocation skills, and has a 9th grade education. So we're like, how do we help? And where do we start? How can we make a difference? How likely is Bob to reoffend and recidivate? So that's kind of what we were tasked with, and that's kind of how we built out the program. So as we're talking, just think about Bob a little bit. So quickly, I was able to learn that, you know, the jail is responsible for so much. They're responsible for mental health, substance use. I mean, it's way, way beyond, you know, supervision and, you know, detention and detainment. And I just want to point out, I think that Brian was doing in the Sheriff's Department, we're doing such an outstanding job with the resources that they had. They were way, way under-resourced to even think about being able to have a true reentry program. So when I went in, I wanted to do a needs and a service assessment. It was very interesting. It was quickly apparent that what I considered a risk assessment and what I considered evidence-based and best practices were not what the correctional community is used to talking in those terms. So I went in and I'm like, so are you guys doing a risk assessment? Yep. And I'm like, okay, great. How about evidence-based practices? Yep, great. You know, so I have this checklist. So then my next questions were like, okay, what risk assessment are you using? And which evidence-based tools are you using? So they were geared more towards placement, like the safety within the jail and where should they be housed. So that's how they were thinking of risk assessment, where in my world, it's, are they suicidal? Are they gonna hurt themselves? And when I think of evidence-based practices, I'm thinking about interventions, like mental health interventions or substance use interventions. So it was definitely an education on both sides. So I did find out that they were doing some region services in the jail. Brian had already been working with Next Ride, with Chad, with Cayuga counseling. We have some individuals in the jail doing the cognitive behavioral interventions. And Pat was also in the jail. But what became apparent was that everybody was like doing their thing and there was like no coordination within that and hardly any evidence-based interventions or assessments being used. So it was really important that we implemented those as well. He also had no money, no funding. The jail only funds one position for transitional services. So one position responsible for every single inmate whose needs are extreme. Most high needs individuals, you will see, I can, say. And so Michelle was doing an outstanding job with what she could. So I do want to give a lot of credit to you and to your staff. And then there was a huge lack of communication between the different disciplines and also knowledge of each, discipline and what it is they were doing. So we were able to use that information to inform the service delivery model that we wanted to use. And the things that were important to us, all of us, were that it would be multidisciplinary and a joint community effort, that we would use evidence-based and trauma-informed best practices, that we would have a seamless and coordinated system of services, supports, and supervision. We would design it to identify and address the criminogenic needs and risks that poses challenges to successful reentry. It looks different for every individual, and we wanted to acknowledge that. We also wanted a pre and post-service continuum that we needed to build. And then we wanted to follow a coordination of care model with intensive services, cushion, and community-based. So we were tasked with a lot, but I think that it's been apparent that a lot of thought went into the model, and because of that, I think it's been very successful.
No, I think one of the biggest things that I'm most proud of is the multidisciplinary approach. Bringing all of the different organizations together, doing a better job of communicating and determining what does each individual in our jail need, how does that overlap to other service providers in our community, and how can we better prepare them. But again, when I took over, everybody was kind of doing their own thing. They were just focused on their own specialty, their own discipline. But to watch that multidisciplinary approach change, we've seen it work so many times in our community to solve other problems. Why not bring it into the jail? And we did, and we're seeing the success there.
So do you want to talk a little bit about our partners? So this is kind of the model that we built and developed. The ICM is intensive case management, and Cayuga Counseling Services does provide that. So we're kind of in the middle of that to coordinate all of the services and the other agencies to be able to provide all of these services. So medical, corrections, supervision, probation, peer support, education, vocational services, housing, substance use, behavioral health, and medical.
Sure, and over the last few years, we've really expanded upon that. And as Heather said, Cayuga Counseling was already in our facility, but we've really stepped that up with some additional support with this grant funding. Case managers, we did have a mental health therapist for a period of time that was working with our individuals in the jail. We've had Nick's Ride in for a number of years, but now we have more time that they're in our facility. We actually have an individual up here from Nick's Ride that's in our jail every day for 5 hours a day, running programs and helping them with substance use disorders. Cayuga County Mental Health has been with us all along the way, but we've actually added some additional time with a part-time person from mental health that's helping with the therapy that's needed with our population. Chad's been in our jail for a number of years, but now we have some additional time that they're there working with those that are dealing with substance use disorders, as well as Liberty Resources. One thing I found is that sometimes one particular entity might offer a service that an incarcerated individual, they don't want to utilize, or maybe they don't like the particular individual that's providing that service. But by having some different options in there, it seems to work really well to make sure that they're getting the help that they need for the particular challenge. We've got drug court in our facility. We've got Cayuga Community Health Network is there helping us with housing when we're releasing people back out into the community. They're directly there with us working on that. We didn't ever have that before. Like I said, we'd release individuals and they'd just be off on their own. We brought the Department of Motor Vehicles in. Then Clerk Sue Dwyer worked with me to get a terminal in our facility so that we could actually update IDs, New York State driver's IDs or licenses if the individual had it, because in many cases, when somebody comes to our facility, they don't have anything. They've lost everything. They don't have IDs, they have nothing. So by having that there, DMV is able to create those identifications right at the facility for us. Social Services is there working with us. Unity House, Community Action Programs, CAP is there working with us. We have BOCES doing some vocational training and some educational training, and Chapel House is there as well. And then we do have some other service providers that are providing Narcotics Anonymous meetings, religious services, things like that, that we've really increased the amount of time that we spend with our population with those two. So it's been key to bring all of those agencies in to provide the services you see around that circle there. And I think that it's going very well.
So Brian did talk a little bit about our funding. So we did receive $750,000, a 3-year grant, federal fiscal year 2021. So we are in year 3 of 3, but we did get a 1-year cost extension. So September 30th of this year, 2024, should have been our last year, but we got a 1-year extension. With that money, Cayuga Counseling employs, again, all jail-based. All of my staff is located within the jail. So a full-time program director, 2 intensive case managers that do push-in services, so in the jail, as well as community-based services when individuals are released. A full-time therapist, and then we also utilize the money Cayuga Counseling did to contract with BOCES to be able to provide the educational programming. And then we also, as part of the grant, contracted with an independent researcher to conduct an independent research contract. So I have 2 researchers, one from Lemoyne and one from Kansas, University of Kansas. They're doing the research part. And then we also used a lot of the funding to have individuals trained in evidence-based programming. So we do parenting classes. We sent an individual to learn how to operate those big cleaning machines, like to clean within the jail and to get a cleaning certificate and all sorts of stuff. And then also some evidence-based therapy treatment modalities as well.
And I think one thing to highlight is with the intensive care managers, they're embedded in our facility, but when an individual is released from our facility, they're still working with their care manager. So they have that relationship in the facility and it carries on with them once they leave. I've also really I like the fact that the peers build those relationships within our facility, and then they continue to work with individuals outside the jail. So, now it's not like we're trying to introduce an incarcerated individual to a peer or to a case manager when they're released that they don't know. They know these individuals, they worked with them for a period of time, and it seems to help us be successful as they carry on.
So the next 2 slides just give you an idea of the service continuum. So these are all of the different interventions that we have implemented as a multidisciplinary team. And then you will see if they're available pre-release, post-release, and the service providers. Because again, it's just not Cayuga Counseling and the Sheriff's Office. It really is a community collaborative, and you can see that. They're basically the services that we've talked about: evidence-based screening, assessment, mental health treatment, service planning, care management, evidence-based practices and treatment, peer support, education and vocational services, housing, medical care, MAT and MOUD, so Medicaid assisted treatment, evidence-based skills group, intensive care coordination, and basic needs. So as you can see that we really did build out a continuum for both pre and post-release. We also work with probation, so Tyrone is here. If an individual is sentenced to probation, they're also very much part of this process as well. So we wanted to kind of stay with Bob and kind of explain what happens when somebody comes in. So Bob comes in, first thing is Michelle, so the sheriff's staff, conducts a Wisconsin risk assessment, which is a screening tool, evidence-based screening tool that we chose. And that risk assessment really drives the focus and kicks off the program. It determines eligibility. Re-entry money on a federal level as well as a state level is only available to high and medium risk individuals. Obviously, they want to get the most bang for their buck. So that's where all of the money is focused on. Going into this, when I had my initial meetings with the jail, they were like, no, we want to provide services to everybody, high, medium, low, everyone. I was like, so do I, but we only have $750,000 and the feds say we have to use this money for high and medium risk. We also need to use an evidence-based tool to determine that. So we chose this one. We chose Michelle to implement that. So she screens every single individual that comes in the jail. If they score high and medium, they're triaged to my program coordinator, who then conducts the New York State Compass assessment. We chose that tool, again, an evidence-based tool on purpose because my staff is already trained in it with the work that they do in pretrial release in both Cayuga and Onondaga counties. Probation utilizes that tool. They were trained in it. I wanted everybody to be able to speak the same language. So we chose to use that. So Compass is done. That really identifies not only the risk of recidivism, because we already know they're either high or medium, but really lays out their service needs so we can start developing a plan and what we call a transitional plan. So for pre and post services, that is done. The results of that is shared with the MDT case planning meeting, and then services are recommended. So then comes the linkage and referral. All of the services are voluntary, so we can have an individual screen positive or, identify risk needs in substance use and mental health and medical and, housing, but they can choose to only participate in, one component of reentry if they want. We don't force anything. Or they can choose to participate in all of, the components that were identified. Again, medium and high risk individuals. So then we have all of the programming going on inside, and we have treatment goals, treatment plans, service plan goals. All of that is reviewed in a multidisciplinary team way and effort, so that we know where we're at progressing on each identified need, and we're making revisions to those plans as well, so it can follow an individual from the time that they first are admitted into the facility all the way through and then post-discharge. When it is time to do discharge, we use another evidence-based tool. It's called the Denver Acuity Scale. That determines the frequency and the intensity of the visits that are going to take place post-release. So supervision visits, level of support visits, and, they don't have transportation. We want to make it as easy and seamless as it is for them to receive the services that they need in the community as they were able to receive them while they were in the jail. So that utilizes it guides our practice. And then we provide ongoing intensive case management and linkage to all the community-based services. So that kind of just lays it out for you to look at. And then we wanted to share some of our outcomes. And it's important to note that we are in the middle of a research project, and the research project is really looking at the longevity. So it's really looking at post-release recidivism rates for 3 years. So we can talk a little bit about the outcome data as far as our grant outcomes. We've exceeded all of our targets. And again, we still have a whole full year to go. So we've wrote in that our target would be that we would provide services to 225 individuals. And so far, as of July, because that was the last quarter that the report was due, we provided services to 306. And then our enrollment data, we said at any given time, we would carry about 45 active cases. We've averaged carrying 73. So as you can see, there's a huge need for the service. And then our initial recidivism rate data, which was measured about 3 months ago, we gave the target of 60%. The national average is 68%. And our recidivism rate for successful completions is 7%.
But I think in full transparency, that's a little bit deceiving. So the 7% number, that's 7% of the 306 individuals that have been part of this program. Many of them are still incarcerated. Some have gone on to the State Department of Corrections. Some of them we're still working with in our facility. So it's not a true 3-year number or a true number with individuals that have been released out into the community. Many of those individuals, I don't have a number for you, are still incarcerated. So I think it's going to take another cycle or two before we really have good data to see where we compare. But seeing what I've seen so far anecdotally, I think that we are having a lot of success. And I'm confident that those numbers are going to be very positive once we see them, out to 6 years and beyond. Unfortunately, we didn't keep data relative to this topic relative to recidivism with the sheriff's office prior to starting this program. So we don't have good data prior to compare this to. We're starting to build this database. But this information is coming from a researcher with Lemoyne College and Kansas State University. This is an independent researcher that's looking at our data, that's giving this back to us and giving us some feedback. And we should have some much more data in the coming months and years, hopefully, if we're awarded the next cycle of this grant. I think it's very encouraging.
Is the recidivism reoffending or going back into jail?
Back into jail. Great question.
Okay.
Everybody, that's another huge problem that we found quickly, is that everybody defines recidivism different.
Mm-hmm.
So we really wanted to be clear with our data because of the research.
And it's not committing a crime. It's
Yes,
about
it's
being
not a mess.
sentenced
It's
back into.
convicted and back in.
Okay.
And just to be clear, also, these are people that come back to our jail. If somebody's arrested and they wind up in a neighboring facility in a neighboring county, that's not reflective in this number. We don't have the ability, unfortunately, to track that. So that 7% number could be higher if somebody's housed in a neighboring facility. We're not going to know that, but we're tracking people that come back to our jail. They're rearrested.
If they were incarcerated in a neighboring facility, wouldn't that help your increase? I guess I'm still confused what the 7% is. So of the 360 people.
Yeah, so take that number and I'm just
Okay.
gonna break it down. These aren't exact, so don't quote me.
Yep.
But we've provided service to 306 individuals. That is total, meaning individuals within the jail that are currently in the jail and those that have been released from the jail. So.
It's like an unduplicated number of people
Yes.
you've worked with.
Yes,
Okay.
yep. So the recidivism rate, the 7%, is how many of those 306 individuals that have been part of our program have been rearrested, convicted, and sentenced back to.
And come back to our facility. So I think just 306 people have not been released from our facility, but they're the total number of people that have actually been engaged in the program. Some have been in jail for a period of time or maybe gone on to a state facility and they're still incarcerated. But just to be very clear, that's not 306 people released. That's 306 people that participated in the program.
So what is enrollment? What is that middle line?
Like active cases at any point in time that our case managers, that our 2 case managers are carrying.
For the 7% are people that got reconvicted back here, back in the county, then that's the, you didn't release 306 people. So they, and what's the target number that you're trying to hit?
60.
60?
Is it?
So that 7%, you want it to be 60?
No. We wanted it, yeah, I mean, yeah.
That'd be the target
Yeah.
number, right?
So The national average of recidivism rate within 3 years of release is 60%.
Go
Or
back-
68, so 68%.
Go
of
back to
individuals
jail.
Go back to jail within 3 years.
Okay.
So
Would be 12. Right? Because I'm confused because why are we doing the same number here? Because it's 7%.
that's the actual of the individuals that we've worked with, the
So-
recidivism rate of the individuals that we've worked with.
If I understand, maybe I understand your question, I'm not sure, but the target that we have for a target, that's what we wrote into our grant proposal. This is what we were going to try to accomplish with this program. And then the numbers, the actual numbers where we're at today are the numbers in the last column,
The
but
numbers are better than what you targeted.
so far, yes, but it's somewhat deceiving. Like, we need to really see what the numbers look like when we get up another 3 years, maybe another 9 years, way out there. But the target was what we wrote into the grant. That was our initial target. I think we're doing much better than that, but the 7% number is somewhat, it's somewhat deceiving because that 60% is a true number nationwide of individuals that have actually been released from jail and come back in 3 years. Not all of our 306 have been released from jail. That's what makes that somewhat deceiving.
All right, so just so I know, explain the interest rate, just that number is accurate. You're doing 53% better than what you normally.
Yeah.
If,
But it's not comparing apples to apples. You just need to be careful with that.
So I know, okay. all right.
Yes. But that's the data we have today based on what we're doing and what we have.
This 306, and the 73, this includes state and federal boards. Is that correct? Or is that just Cayuga County residents?
So not federal board.
Not federal, but out of county, it would include out of county boards.
No, not out of county board.
It's just Cayuga County inmates from Cayuga County arrests.
Yes, I believe
Okay.
so. You're not including state
Yes.
board, that's correct.
Yeah.
because initially I thought you thought we programmed
Oh,
for
that was
everyone.
that was one of my questions.
We do still provide services for everybody that comes into the facility, but I don't believe the state, our local boards that are not from our county are included in this program.
Okay, so this is
And I can
just
speak to
Cayuga
that.
County board inspired.
Yeah, so we developed it that way because we
Want to impact our own
knew that the
community.
federal individuals would be being released to other places. We wanted to utilize this for our community, so that's why we chose to exclude them.
That's why I was asking. I'll get the 7%. That's why I wanted to verify where people were coming and going
So
from.
the listing of these programs, you are not required to do, to your credit, you are providing these because it was important to you. There are a subset of things you have to do, MAT, and meet the assess mental health needs and serve people. Is that fair?
Correct. My goal is to reduce recidivism, right?
Right.
Keep on the right tracks, they're not coming back. And I wish we could measure the savings that we see by, putting somebody on a successful path. We can't measure that, but a lot of the programming is not required.
Right.
Some of it, since we've implemented this, has become required, like with the MAT program.
Right.
They are requiring certain therapy and things that you're doing along the lines of MAT. So we're ahead of the curve.
Right.
It's made that very easy. When Oasis said you need to start providing
Right.
these services, we already were. It's very easy
Right.
for us to do that.
Because when you started, some of that wasn't required, but certain things are now required, mental health and the MAT for.
We're almost there, I think.
Yeah, so I just wanted to give you guys an idea of who are we serving. So
Yeah.
76% of the individuals served are males. Age ranges 18 to 64 with a mean age of 36. White is 68.9%, followed by black 25.4%, multiracial is 1.6%. Most are single, 78.7%. 16% have less than a high school education, and 17% have a high school diploma and some college. Our largest special population, no surprise, is the homeless, 52.5%. And then this was really interesting to me. The average number of prior arrests was 13. So 13 per individual, with an average of 6 prior convictions and 4 prior incarcerations. That speaks a lot. 16 years of age is the time of their first arrest. And then this also says a lot, and I'm really happy that we decided to track this and make this a huge priority, although our staff was not at the time, because it's a lot of work. But 80% of the individuals in our reentry program have experienced abuse or trauma. 42 self-reported behavioral health issues. 30% self-reported substance misuse issues. And our average ACE score is 4, which was extremely telling to me. So adverse childhood experiences was a 4, and only 16% nationally individuals have an ACEs score of 4 or higher. So again, it's really telling the population that we're serving.
This is one of the things that really concerned me the most when I learned it. The 80% that experienced abuse or trauma. I didn't realize that many people in jail in our facility, that were facing those types of those challenges, but it has a huge impact on
Sure.
what they're doing out there and the recidivism rate. So we need to address that trauma, and we're trying to do the best we can with the resources that we have.
Are you surprised at how many people have agreed, since this is all voluntary, to participate?
Yes.
I find that pretty amazing.
It is.
Yeah.
Really.
I mean, you look at general population who won't engage in services.
Oh, yeah. And then, not only that, but then to stay engaged after they're released. I mean, it's amazing, really.
Well, I think that you don't have all of the outside influences when you're in the facility, right? So I think it's easier for folks to work on their challenges, to work on their recovery, work on, their trauma and their mental health issues that are driving some of these behaviors. So again, that's why I thought it was so important that we started to look at doing this work in our facility when we have them there.
And then we just have a few highlights. So we've exceeded our goals and objectives for each report period. And our cross-disciplinary collaborations and partnerships continue to grow. That's the foundation of all of this work. We received 100% on our site visit and our regulatory visit from DOJ when they came. And the United States Department of Justice asked Brian and I to be a presenter at their national conference. So they wanted us to present on our unique program model as well as building collaborations within the community, because this does not happen across the country. So we went to Maryland and we presented, and I just found out today that we were asked again to present at this year's. I didn't tell them yet. Yeah, so that's wonderful, I think. We did get the 1-year no cost extension. Our research component will continue. And we were able to really sit down as a community, look at, here's what we've done, here's what we've accomplished in the 3 years, what do we need? So I used that information to write the next 2 grants that we have out there for continued funding. So we're just gonna end with that. I applied for 2 other DOJ BJA grants based off of our community needs assessment that we conducted, which identified substance misuse and behavioral health as one of the top priorities, as well as housing, peer support, and intensive case management. So we utilized 2 opportunities. One is focused all around substance use and behavioral health. And we wanted to be, I'm very unique, in case you guys don't know that about me. I'd like to be outside of the box and ahead of the curve. So I wrote to develop a hip hop EMDR program, which is evidence-based. So EMDR is for trauma, because we took a look at the trauma, and it's the rapid eye movement desensitization, but it's adding that cultural hip hop piece within it. And hip hop therapy is, again, evidence-based therapy. So I think that would be wonderful if they award us that. And then we also put in a DBT component. You heard Lauren talk a little bit about that if you were at the first meeting. So dialectical behavioral therapy, again, it's for trauma, but there is a corrections based program, and it's just being implemented right now on a national level. So I was like, I want in on this. And Brian was like, yeah, great, So we wrote in to get training for that. Not necessarily that it'll be Cayuga Counseling doing it, maybe mental health or one of the other partner agencies. And then the second grant is really Cayuga Counseling as the lead, but really giving our money to other agencies. So housing is a huge thing. So working with the health network, funding them for some more housing, supportive housing. DSS was wonderful to work with us too on that initiative. And then we are going to pay Nick's Ride to increase our peer support because that's been really wonderful and most engaging and most getting people engaged in staying with the services. And then also intensive case management. So that's $750,000 grant. They're scheduled to start 10/1. We won't find out probably until 9:30 if we cut the either one of them. Again, are both extremely competitive opportunities, but we're hoping that we'll be able to get those. If not, we'll be applying again next year. The same grant opportunities come out every year.
Sure, I'm really hopeful that being invited by the Bureau of Justice Assistants to come down and speak at their conference, that's a positive sign that we will, be able to continue with another grant award or hopefully 2 grant awards. I really like the fact that we're using the research and the information that we're gathering with our research to write our next proposals. I think that will look favorable for us. And I think, really looking at the trauma, the abuse that people have sustained that are in our facility and how we can potentially address that through certain therapies. I think that that's really key to use that research and that data to drive, the services that we're going to continue bringing into our facility.
The Community Health Network, who did that kind of pilot program where they're the landlord for 4 or 5, with apartments, has that taken off?
We do have people in their apartments. And so far that's been favorable. We've had a few that haven't been successful, but we've had many that have been. So since April, that's been online since April. I think that I would like to see us, I hope we get the housing grant. I hope we have other grant opportunities that will help us build upon that. Because right now, one of the things that is most challenging is we will work with somebody in our facility. They're ready to re-enter, they're ready to go. We release them. And if they're homeless, sometimes they wind up in one of our hotels. And I've even heard that sometimes they wound up sharing a bedroom with somebody that's using drugs on a bed next to them. And we've just released them and worked with them for many months to address their addiction issues. It doesn't work.
Right.
So, we're going to continue to look at strategies to address that because we're losing some people when they're released because of challenges like that. And we'll continue to try to address those things with some grants. And I just real quickly, I wanted to mention that at our last meeting, I talked about the fact that I was going to try to spearhead a meeting with some of our department heads, social services, mental health, some of our other community providers to look at homelessness in our community. We are having that meeting tomorrow, a number of department heads and community providers to talk about some of these challenges, to talk about some of the other challenges we're seeing in our community and see if there's maybe some strategies to mitigate some of this. I know we're not going to solve the problem tomorrow, but maybe we can start to have some conversations that will help us address some of these things in a way that will be more cost effective and maybe mitigate some of these challenges that we're seeing. Because I think our numbers are going to continue to grow as we get into the winter months.
Good luck on that, really.
And we'll be bringing that back to the legislature, but that's all we have on that. I just wanted to share that with you. I think that a lot of people are doing a lot of great things with the facility. And I'm very hopeful that we're going to continue to see this funding come. But I think we do need, as a community, we need to address some of these challenges, both in and outside the facility, in a multidisciplinary way to address these challenges we keep seeing coming our way. It's more than just throwing money at something. We need to be proactive. We think down the road, where are we successful? Where are we seeing the challenges? Where do we have an opportunity to change some things for a positive impact? And that's what we need to be doing collectively.
And I know that Brian, he didn't tell you guys this, but he was approached by DCJS. So we get the federal money. DCJS is a state money. We don't get anything for reentry, but our governor has made it a big priority to allocate funding for reentry in New York State, and DCJS will be the state entity that's overseeing that. So they reached out to Brian because they heard about our program. And so I know that they were interested in having the sheriff come up and talk to them about the work that's happening in this jail.
Yeah, and I'll be providing some of this information to DCJS too, so maybe that'll open up some opportunities with some state funding to address some of this too. So I appreciate that. Any other questions relative to this or anything on my report? Thank you, Heather. I appreciate the opportunity to speak about that tonight. Hans?
I do have a question, word I never ran across before. Criminogenic. What does that imply?
Maybe we'll have to have Heather define that.
Criminogenic, the word.
Yeah, so that's the likelihood the risk to reoffend and the attributing factors that contribute to the likelihood that they would reoffend. So substance use. So the factors that contribute to criminal behavior that they've engaged in, peer associations, are they homeless? Do they have a job? Those type of factors.
That has nothing to do with genetics.
That's an
That's what it
ongoing
looks.
debate.
Looks like there's a
Yeah.
criminal element.
That's definitely an ongoing debate, but not how that word is defined.
Well,
There's definitely a genetic link to mental health issues and substance use. So they are, identifiers of that, but
I think for me, we realize that not everybody's gonna be successful, right? We have a large population that unfortunately we just can't move in a more positive direction, but our focus is going to be, on those individuals that maybe we can give them the tools and the resources to get on the right path, and the goal is to have them back to our facilities. I think we all win if that happens, so appreciate the opportunity to speak about that.
thank you.
But thank you. Thanks.
Can I get a motion to adjourn?
Make a motion. Second,
Triple it.
I get it. Ladies' room. Sorry.
Can't make a motion here.
Yeah.
I'm just trying to figure out.
Doesn't do it the
Okay.
way we do it.
All right.
Yeah.
Ridiculous.
Well, you gotta get that set before you can.
If they want to hedge theirs, we gotta hedge ours.
She doesn't have her county phone with her.
We accomplished nothing.
Really?
Conversation.
Military shouldn't have her.
First.
Where'd she go?
She went out the door, so.
Don't worry about it.
Huh?
I can't give it to her anyway. She doesn't have her county cell phone. Can't get it on her phone.
Yeah, you're not gonna do it on a public phone for executive session.
Right. Well, that's she's supposed to call in, but she's talking about when you come back in to do it on a Zoom.
All right. So we're gonna get started here. I'll call the meeting to order now. Before we go into executive session, I'll have a little bit of an update here. But let's start with the roll call.
Jonathan Anna,
Present.
Ben Vitale,
Here.
Tom Wenzel,
Present.
Bob Shay,
Present.
Hans Petcher,
Here.
Mark Strong,
Here.
Heidi Nightingale,
Present.
Elaine Daly,
Here.
Stephanie DeVito. Used. Brian Muldrow,
Here.
Elaine McDab Coleman. She's not gonna be on?
She's on.
Nothing's on here.
Down there. Yeah, blank.
I'll come in IT every time I run a meeting.
You want me to answer that? Not on Zoom. I sent her a text. I just sent her a text just in case. Hey, look.
I think maybe.
A link. Is what she says.
Which,
Well, how come there's nothing coming up though? What did you do, Ben?
The last time I ran a meeting.
Yes, Ben.
Yep. I'm a bad omen.
Is everyone on?
I knew computer. She'll be running around Black Friday getting us off computers.
Everything you can on Black Friday breaks.
Yeah, she don't care. As long as it's on her budget, okay.
Don't forget to apply my discount.
Yeah, how many points do you save?
Yeah. Yes, we don't want, one girl.
Be a long 3.5 years.
Possibly 4. Oh, yeah. There she is.
No.
I see her.
Finish the roll call.
Elaine McDab Coleman. Can you hear me?
No.
Trying again.
Elaine, can you hear us? You muted?
I can't.
Not done working.
She's muted right now.
Can you guys hear me?
Yep. I just doing the roll call. So Elaine McDab Coleman.
Present.
Thank you.
Can't see her.
We need to see her. We should see her.
I'm gonna see if she was voting.
Excuse me?
I'm present.
We're good.
Oh, we're good.
Okay, so pledge of allegiance, please.
I pledge allegiance to the flag of the United States of America,
And to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
It's the moment of silence. Very much. Okay, so the plan here is to go into executive session to discuss the leasing of a building. I will tell you that the conversations will be strictly around that subject only. We're not going to go into subjects about the county office building or any other things. We're going to kind of stick very close to the properties of an executive session. If we wander and I don't stop you, I'll ask the attorneys to speak up. If at some point we want the staff and everybody to leave, somebody grab my attention or whatever, we'll do that. Other than that, I'll be looking for a motion to go into executive session to discuss the leasing of property.
Move it. Second.
All in favor?
Aye.
Anyone opposed? Carried.
Okay, sir. How old are you?
Have a resolution here. You're been increased. 90 was.
Did they modify the 90?
I'm gonna name that probably Edge One.
It's the same as based on rental.
Now, let me look at
Negotiate the contract.
We think we needed a 2/3 vote. Right.
Hey, Fred,
I'm sorry?
needs 2/3
that updated,
No,
remember,
it does not, because
Well, you have that on
monies
here.
are not coming.
on there.
updated one that includes the basement.
Rich, this doesn't need 2/3, right?
No, it's not coming out of this, fund balance.
We can take that off.
Transfer from other accounts.
Yeah, because they included the basement, Mark.
But can you send that to me so I can take that off? Or if you want to take it off, because you got
Sorry, I
2/3.
thought you said John, just up. It's my ear again. Earlier, actually.
Instead of getting damage, I want. We'll make an amendment or just off of the. Make it.
Because it's on the record.
All right, for your information, you just got a resolution handed to you. If you look at the heading, it says 2/3 vote. We do not need a 2/3 vote. We're not adding money or anything, we're just transferring money. So when we get to this, I would ask for a motion for the resolution in a second, and then an amendment to take the 2/3 off. Okay? So I would look for a motion, or I would call this ledge 1. And second, so that we can have discussion.
Second.
You got a motion from
I'll make the motion.
Oldro, second,
I'll second.
Elaine. Okay. Do we want to have a motion to amend ledge 1 to remove the 2/3 vote
Yes.
amendment? Oldro, second.
I'll second remove.
Lee?
Yep.
Okay. Do we need a discussion on the amendment? All in favor of the amendment?
Aye.
Anyone opposed? Okay, now a discussion of the resolution with the amendment. And do we want Fred or somebody to go through this with us real quick, or?
I just want to have a motion to put the resolution as amended on the floor, just so there's no.
Yeah, as amended.
Okay, motion, put the resolution on the floor
Rolling in small.
as amended.
I apologize.
Second, Heidi Nightingale.
Okay.
Now we can have a discussion about
Now, yes, I'm comfortable now.
the,
Thank you.
okay. Do you want to just go through this real quick, or?
I can do that.
Do the legislature want Fred to kind of review this quickly or not?
I think that's important for the public. I think the employees have been waiting for something to hear from us outside of executive session. So while it might feel exhausting for some of us, we definitely have public employees, public and the employees that we're responsible to, that I think should hear some kind of discussion.
All right,
I'll be happy to go through it.
there you go, Fred.
So the title, authorizing the chair of the legislature to lease office space for Department of Social Services and authorizing the transfer of monies. Whereas on the early morning of Wednesday, May 29, 2024, a substance later determined to be vermiculite was discovered in several locations within the county office building. And whereas the building was immediately vacated and remains vacant while the environmental consultants and contractors engaged by the county continue to conduct tests as well as assessments of the county office building, COB here, in accordance with the requirements outlined in the New York State Department of Labor Asbestos Standards, Branch 12 NYCRR, Part 56. And whereas the county is working with its environmental engineers and consultants to determine the cause of the vermiculite infiltration and to develop a remediation plan that will abate the contamination within the county office building and prevent the reemergence of either vermiculite or asbestos. And whereas the county has been advised that it will take up to 2 years to complete the abatement of the COB. And whereas the county legislature recognizes that to protect the health and safety of both the employees and the public, the county office building will remain closed while the abatement process is continuing. And whereas the county legislature also recognizes that despite the closure of the county office building, it must continue to provide services to the public and therefore needs to obtain office space that is suitable for its employees and will allow for the safe and efficient delivery of services to the public. And whereas the operations team, parentheses, legislative chair, county manager and operations officer, close parentheses, has conducted an exhaustive analysis of potential properties within the city of Auburn and nearby locales that include but was not limited to the evaluating employees and services space needs and the availability against the current time constraints. And whereas based on the outcome of the analysis of properties, the operations team is requesting authorization by the legislature for the chair to enter into a lease with 63 Genesee Street LLC for the entire premises located at 63 Genesee Street, Auburn, New York, for $20,005 per month.
29.
29, thank you. $29,005 per month, with the intent to house operations of the Department of Social Services, County Treasurer's Office, and the Finance Department, and other departments for a period of 2 years, with an option for a 5-year extension. And whereas the estimated costs to outfit the space at 63 Genesee Street is $1,100,000, with the rent for 3 months in 2024 is approximately $90,000. And whereas the estimated net cost to the county for outfitting and occupying space at 63 Genesee Street after reimbursement from state and federal sources is $587,500 for 2024. Now therefore be it resolved, hereby authorizes the chair of the legislature to execute and deliver a lease agreement by and between the county of Cayuga and 63 Genesee Street LLC for the premises known as 63 Genesee Street for a term of 2 years, with an option to extend for an additional 5-year term at a monthly rent of $29,005, and upon such other and further terms as may be negotiated by the county attorney's office. Be it resolved that the chair of the legislature is hereby authorized to execute any and such agreements, documents, or instruments as may be necessary to purchase the furniture, equipment, and related facilities required to outfit the leased spaces for these departments and make them suitable for occupancy. And be it further resolved that the Director of Finance is hereby authorized to make the following budget transfers for fiscal year 2024. Do you want me to go through the individual line items?
No.
Part of the resolution. Okay, I will do that. Expense account, increase. Account A 60102-52004, $200,000. Increase expense account A 60102-52100, $700,000. Increase expense account A 60104-54059, $200,000. Increase expense account A 60104-54065, $75,000. Decrease expense account A 10144-545, $334,000. Decrease expense account A 10164-54000, $90,000. Decrease expense account A 10104-54229, $178,500. Revenue accounts. Increase account A 60100-43601. increase A 60100 $293 and $700. Thank you. $293,000, $750. Thank you, Mr. Vitale. Increase revenue account A 60100 44610 $293,750. Together with any and all journal entries as are necessary to carry out the intent of this resolution. And be it further resolved that the budget officer and the director of finance are hereby directed to incorporate into the 2025 and 2026 budgets such funds as may be necessary to carry out the intent of this resolution. That is a resolution before you.
Thank you, Mr.
Numbers guy. Any discussion? Mr. Petcher.
Well, I'm gonna vote against this resolution. I'm not disapproving of the contents of the resolution. I'm disapproving of the whole damn process. The legislature has not been asked about anything, what we want to do, and this is supposed to be our job, what we want to do. We have not been consulted at all. It's been 3 months, and all we're getting is pebbles of what needs to be done. And again, I'm not disagreeing with that, but I feel it's an insult to the whole legislature that there hasn't been a meeting or meetings for us to discuss what we think ought to be done, because we haven't been told anything.
Okay. Any other discussion?
I think for clarity, if this resolution was to pass tonight, there is still a few months worth of readying the space. So this isn't going to be as of 2 weeks from tomorrow, everybody moves in. Is that that's the reality? You have quite a bit of work to do?
Correct. We have to contact, vendors. We have to stage the electrical, cabling, network, things like that.
1st of December, I think, would be aggressive.
So these,
Mr. Muldrow?
these are estimates, right? So obviously it can vary up or down slightly. But you did your best to know where we're sitting at.
Correct.
If there are any further questions, otherwise I'm trying to stay on schedule here.
Hey, Ben.
Yeah.
Can you hear me?
Yeah. Go ahead.
Oh, thank you. I just wanted to kind of recap, since I'm not there in person. I just wanted to impress upon the group that, we've been at this emergency for 3 months. We didn't even know what we were dealing with. We have come to a threshold of new knowledge to say we cannot be in that building under the next timeframe of 24 months. Also, we have been looking high and low and scouring for placement. The day of the meeting last week is when we were finally getting whole numbers on this particular property. So to insinuate that we've been sort of sitting on this or neglecting our duty of informing you is definitely not the case. We've been trying to just uncover what it is that we've been dealing with. This has been quite a situation that we did not know would balloon into what it is today. And so, we've been just handed this process that we now have to undergo. And it's a huge mountain to climb. None of us planned on it. But I need to clarify with you that that's not a fair statement to suggest that you haven't been informed. I've had nothing to inform you with until last week. Nothing solid to talk to you about. And in fact, many of the properties and options that we were considering were hard-nosed with, members of the resource group that are sitting amongst you today. So, we've scoured high and low. I think we've done an immense amount of work in a very short period of time. At the end of the day, it's our obligation and our duty to get these folks in chairs, and it's our obligation and duty to serve the public in a way that's appropriate. So I just wanted to clarify that for you today. Thanks.
Thank you.
Ben,
I will also be asking for a roll call vote. But before we go to that, Hans, I think you have one more question or comment?
comment, I guess. Basically, my objection is that there's no overall plan that we should have made. Do we want to keep the building? Do we want to sell the building? Do we renovate the building? Nothing's been said. And how can you make decisions when you don't even have a basis for doing that? That's what my objection is.
All right, thank you for the comment. I'm not gonna get the answer. I could answer that right now, but I'm not gonna, because I think we want to get to a vote here before people have to leave. So again, I'll ask for a roll call vote. So Sheila, if you might.
Yep. Jonathan Anna,
Yes.
Ben Vitale,
Yes.
Tom Wenzel,
Aye.
Bob Shay,
I'm gonna vote no because of the journal entries.
Hans,
No.
Mark Strong,
No.
Heidi Nightingale,
Yes.
Elaine Daly,
Yes.
Stephanie DeVito.
I don't know if she
She on
can
my
vote.
phone?
No.
Yep, she was.
No, yeah, but she
Oh, she can't see her.
has to be visible.
Yep.
I tried to get on Zoom and I can't get it on there.
That's
Okay.
okay.
No. Brian,
Yes.
Aileen McNabb Coleman.
Yes.
Okay, so 6, 7 yes, 4 no. Fred.
It passed.
Pass.
Okay, any other business to be brought before this group tonight? Otherwise, I ask for a motion to adjourn.
Second.
Elaine, second, Heidi, all in favor? Anyone opposed? Thank you very much, everyone.
Thank you.
Yeah.
Thank you.